Module Overview. This module addresses the core principles of infection control and biosafety, emphasizing the critical responsibility of phlebotomists in maintaining aseptic conditions, preventing contamination, and minimizing risk to themselves, their patients, and the public. Phlebotomy, being a high-contact and invasive procedure, exposes both practitioner and client to a multitude of biological hazards, including bloodborne pathogens such as HIV, Hepatitis B and C, and emerging viruses, e.g., Ebola, SARS-CoV-2. This module arms you with the knowledge, protocols, and practical techniques to uphold biosafety protocols, implement standard precautions, handle biohazardous materials, and manage exposure incidents. In addition, the module conforms to WHO, CDC, OSHA, CLSI, and ISO 15190 standards for clinical biosafety, and is essential for any institution seeking international recognition and training licensure. 3.1 Understanding infection control in healthcare. Infection control involves a set of practices intended to prevent healthcare-associated infections, HAIs. These practices are built on chain of infection, pathogen, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host, breaking the chain through sterilization, hand hygiene, PPE, and vaccination. Phlebotomy-specific applications prevent cross-contamination between patients, proper sharps handling and disposal use of skin antiseptics, cleaning blood spills immediately. 3.2 Standard and transmission-based precautions. Phlebotomists must implement standard precautions on every patient, regardless of diagnosis. Hand hygiene before and after each patient. PPE, gloves, lab coats, face shields. Sharp safety, immediate disposal in puncture-proof containers, environmental cleaning, respiratory hygiene. Transmission-based precautions include contact, gowns and gloves, e.g. MRSA, droplet, surgical mask, e.g. influenza, airborne, N95 respirator and negative pressure room, e.g. tuberculosis. Key insight: every phlebotomy interaction must be treated as potentially infectious. 3.3 Personal protective equipment, PPE. Correct use of PPE is non-negotiable. PPE item, purpose, when to use gloves, prevent contact with blood fluids, always during blood draws. Face mask barrier against droplets, coughing patients, or splash risk, gown, lab coat. Protect uniform show skin during spills, heavy exposure work. Goggles show shield protect eyes from splashes, arterial draws or aggressive bleeding. Donning and doffing order, WHO. Donning, gown, mask, goggles, gloves, doffing, gloves, goggles, gown, mask. Improper removal is a key vector for contamination. 3.4 Biohazard materials and sharps. Safety. Biohazards are biological substances that pose a threat to human health. Phlebotomy-related biohazards use needles, lancets, syringes, blood collection tubes, especially if broken or leaking, contaminated gloves, gauze, cotton balls, specimen transport containers, proper sharps. Protocol: never recap needles. Use one-handed scoop technique if recapping is unavoidable. Dispose immediately into clearly labeled sharps containers. Report sharps injuries within 1 hour and begin post-exposure protocol. 3.5 Spill management and cleaning protocols. Blood or specimen spills are common. Response must be immediate area isolation. Don full PPE, cover spill with absorbent material. Apply disinfectant, 110 bleach solution minimum. Allow proper contact time, at least 10 minutes. Dispose of cleanup material in biohazard waste bags. Complete incident documentation. 3.6 Hand hygiene and aseptic technique. According to the CDC and WHO, hand hygiene is the most effective method of infection prevention. Phlebotomists must wash hands before and after patient contact, after removing gloves, after contact with contaminated surfaces, before eating or touching face. Aseptic technique. Use 70% isopropyl alcohol swab. Allow skin to dry completely before puncture. Avoid retouching clean site with gloved fingers. Do not blow on site. 3.7. Post-exposure management. If a phlebotomist is exposed to blood, e.g. needle stick, splash, stop work immediately. Wash site with soap and water or flush eyes with saline. Report to supervisor or infection control nurse. Complete incident documentation. Start post-exposure prophylaxis, PEP, if necessary. Blood tests for both worker and source, if permitted. 3.8. Biosafety standards and accreditation compliance. This module is aligned with OSHA Bloodborne Pathogens Standard 29 CFR 1910-1030, Laboratory Biosafety Manual 4th edi, ISO 5190-2020, Medical Laboratories Requirements for Safety CLSI GP17A3, Clinical Laboratory Safety Guidelines. Every phlebotomy facility and training program must implement these to ensure legal compliance, patient safety, and institutional credibility. Module 3. Learning Outcomes. At the end of this module, you will be able to identify and apply infection control protocols for safe phlebotomy, implement proper use of PPE and sharps handling, respond to exposure incidents correctly, manage biohazards and spills using WHO and CDC standards, demonstrate aseptic technique and environmental hygiene procedures,